PLATON is a molecular registry which we have established here in Germany because we realized that we do not really know a lot about the genetic alterations. I mean, we have now a very clear understanding which alterations we can find in which frequency, in which tumor type, which is good and helpful. And at the moment, we are clearly seeing more drugs, targeted therapies that can inhibit specific genetic alterations. However, we do not know whether these alterations have any prognostic or maybe even predictive impact on, for example, sensitivity to chemotherapy. And for all comer population, we can do a retrospective analysis, but in these cohorts, we rarely have really good molecular profiling of the patient, and it's very expensive to get it. So we do not have these data, and since many of these ongoing studies, phase 2 studies, which are signal-seeking, are single-arm studies, we do not have a good understanding about the natural history of these patient cohorts, genetically defined patient cohorts. And therefore, we decided to establish the molecular registry where we provide molecular profiling at the time of first diagnosis in the palliative setting. And then we are collectively collecting the clinical data to document, in the end, the natural history of these patients. And we think that we can not only learn more about the prognostic and potentially predictive impact of these genetic alterations, but the idea of PLATON is also to connect physicians and researchers, so that we can basically include more patients into clinical trials. And on the other hand, we can also perform post hoc analyses because we are collecting not only clinical data, but also tissue. So we can also do molecular correlates with the data and tissues we are collecting in PLATON.